for the Guam Behavioral Health and Wellness. What is the C for? Is it
Center.
Center? Sorry,
Center.
brain. I'm sorry. It's been a crazy
Okay.
morning. I think it's all catching up to me now.
Good morning.
Right. Good morning.
It's there on her background.
It's
Right.
Friday.
Thank you. It's right on
It's
your
Friday,
background.
but sometimes, yeah, it's Friday, but sometimes it's a Friday, but feeling of a Monday.
Right. Yeah.
We all get that, right?
It's been a
Yeah.
long week.
It has been a long year.
Yeah. True.
Therese, good morning and
Long
thanks.
year, but good morning. Good morning. Thank you for having me.
Right.
Always a pleasure.
Yes, indeed. And I guess we'll just start with let's go ahead and start with the crisis hotline. You guys still getting a lot of calls into the hotline? And what types of calls? Who's calling? What are they saying?
Absolutely. The crisis hotline 647-8833. We're here to help anyone. It has been in existence way before COVID, but of course it's more and more popular, which is because people, that's what we want. We want people to know that number the way they know 911. As I mentioned before in previous times on your show.
Therese, sorry.
Yes.
You kind of broke up a little bit right at the beginning, so if you could just start over, I'm sorry.
No problem. No problem. This is the bumps on the road for technology.
Right.
So Guam Behavioral Health Crisis Hotline, 647-8833, has increased in volume since COVID started, since March. We have been in existence before COVID for many, many years, decades. When I was the director of Sanctuary, we actually had the contract of answering the hotline. Interesting enough, I'm now on the seat of the Guam Behavioral Health side, and it's no longer contracted out. We're handling it. And so, yes, the volume has definitely increased since COVID. We're looking at a pre-COVID number of 25 to 30 calls a month, and we are averaging about 525 calls a month now. So that is a tremendous volume increase. I've just gotten the latest data, some stats. We're still heavy inundated. A lot of the callers state anger, confusion, anxiety, feeling of helplessness. We got some suicide ideations. Just people wanting to talk, people wanting to load down, let their load off, confusion, depression. So the typical, those are some of the typical calls we get. There is substance abuse. Of course, we got calls for depression, as I mentioned earlier, anxiety, hallucinations. We've gotten calls for sexual abuse, physical abuse, family violence. So I mean, and these seem so grim, these topics, but I'm very, very pleased that at least people know the number and the calls are coming through, and we're helping them where we can. Even we're getting calls regarding, some legal issues, definitely employment and financial issues, housing, anything that's causing anybody with anxiety. They're calling and trying to get either references or just how do I deal with this? Clearly the financial issues are probably, I don't know the exact breakdown for the number I'm reading now, but it's probably folks that have lost their jobs or reduced pay completely. So definitely an increase in volume. Again, it's unfortunate that we need to be here, but we are here. And so that's the good thing. And so So that's where we're at today. Um, some of the things that, and if you don't mind, I'd like to mention, first of all, Chris, thank you. Thank you for agreeing to be part of the Guam Behavioral Health Lunch with the Prevention Staff event that we're having on November 18th.
Right.
And,
Yeah.
and I appreciate that. And that, for the people of Guam, is a monthly series during lunchtime. It's during your lunch break from 12 to 1:30. And every month, we're going to have Guam Behavioral Health is going to launch on their Facebook page a conversation with some folks. And this November 18th, this month, it's about fostering healthy relationships with social media. Last month, it was regarding suicide. And so I just want to thank the panelists, and Chris, you're part of that panel, for agreeing to do that. Dr. Fergerger, our staff psychologist, will be part of that panel. Yourself, Livia Marati with Ina Wellness, and some, I think we're trying to confirm another business individual that hasn't been confirmed yet. But I do encourage people to, you want to break from the everyday mundane things, and you just, I know it's interesting because it's in social media and we have to be in the Zoom room. But it's definitely a different topic. It wouldn't be your work-related topic. It's just a different accommodations for people to listen about, converse, and dialogue. And so we encourage people to log on. We encourage people to log on and register at the Guam Behavioral Health website or Facebook page. And so again, thank you for that. I think definitely a topic that's very relevant, right? Fostering healthy relationships with social media. And so thank you again for that.
Of course, Therese, always glad, always here to help. Yeah. Can we talk a little bit about the other services that GBHWC offers, and just maybe just a round robin update?
Sure, and thank you again. So, you know, the holiday season, well, just to wrap up a little bit about the crisis hotline, one of the seasons that the crisis hotline was more and more popular than other seasons is the holiday season. And so, unfortunately, we're just going to be popular. The hotline number is just going to be popular year round, which is a good thing. But in the past, we put more effort in promoting that number during the holiday. And so during the holidays, you're going to see the typical compounded holiday blues because of COVID, because of the inability to gather the way we normally gather. And it's the holidays, and more people want to be with more family, bigger, larger number of families, extended families. And so the crisis hotline will be there for them as well. And so COVID has just intensified the need for the holidays and the holiday blues. And so we just want to reassure the people of Guam that the crisis hotline will continue to be in full swing and full service during the holiday season, 24 hours a day, 7 days a week, 647-8833. With regards to some of the programs, and thank you for asking about, we do many things. We're still open 24/7. If you find yourself in that the hotline is just not enough, we encourage people to come up, and we are open, and we take walk-ins, of course, very carefully, social distancing, mask, and we take intakes, and we see people still.
Therese, aside from the increase in the phone calls, I was just going to ask that aside from the increase in the phone calls, that you're averaging around 20, or so a day for the month, are you also seeing then an increase in the intake? Or have you seen?
So there is a definitely as the volume of calls increased to about 520 a month, we are looking at also an increase of intakes and assessments, as well as an increase, a high number of admissions to our stabilization units. And so everything is high volume at the department, everything. So as it's a major indicator. As the calls go up, so that's just an indicator of what the community is feeling. And I'm just so pleased that people know where Guam Behavioral Health is, know our hotline number, and getting the help they need, and reaching out and getting the help they need. One of the things that COVID has really, really pushed us to do more of, that we normally don't do a lot of, is what we call the trauma response team. Trauma response. And so just this week alone, we mobilized the trauma response team to the Guam. I see my friend Paul Tapau, to do a debriefing session on the major incident that occurred this week with the Guam Police Department and the shooting. And so we responded to Guam Police Department's request to do debriefings for the officers involved in that shooting. In addition to that, you had my good friend Rory Respicio on your show a couple of days ago, sometime this week, talking about the Port Authority's first death in their coworkers, among their coworkers. And he reached out to me, and we are ready to, again, dispatch a trauma response team to provide a session for those coworkers who are greatly affected by the death of their coworker. So COVID has really touched our homes with the number of, I can't even, every time I get a release about another precious soul dying, the only thing I can do is bow my head and ask for peace for that precious soul. And it's pretty disheartening when you have to constantly pray every day. But we need to do what we need to do, because the realities are our community is sick and people are dying, and the souls need our prayers and our people need our help. And so Guam Behavioral Health is here to help departments such as Guam Police Department, Port Authority of Guam. We've gone to Department of Agriculture. We've done numerous National Guard debriefing sessions that has been asked, and so many more. And so trauma response service is definitely a service that we never needed to do as often as we do today. But glad that we have the training and the staff that could.
Well, that's why we wanted to bring you on, because we often hear about the dire situation over at the hospital, and it would, yes, to me, it would mean that a similar situation is unfolding for the Guam Behavioral Health and Wellness Center, that you guys seem like you would be also overworked because of the stress and the anxiety of everybody out in the community. So we really do thank you for everything you guys are doing.
Yes, that's right, Sabrina. It's the stress and the anxiety, not just of the general population of the island, but also of the healthcare providers, the frontliners, the people who are at work, who are directly or indirectly affected by COVID. And so we have services for staff and workforce, and we have services for the general population. And so as GPD gets inundated, as the Guam Memorial Hospital gets inundated, so does our service. We're linked. We're linked arm in arm. There's no way that the volume of cases at the hospital and the volume of COVID responses that GPD goes through is not going to affect Guam Behavioral Health. We very much work with these agencies all the time. And so with GMH and public health, we have created connections so that we're available for their staff and have a direct line to our professional staff. So we're creating systems so that everyone in every entry point can have access to services. And so with that, that also means an increase in need for more professionals in this field. And so one of the things that I would like to mention is that I am hiring counselors. I am hiring folks with counseling degrees. I'm in need of psychiatrists and psychologists. We're holding our own, but as volumes increases, so does the cases, and my counselors' cases has tripled. And this is not tripled, quadrupled even. And this is not one of those things that they see you one time and you're out. Yeah. You know, sometimes treatment plans is, 6 sessions, 12 sessions, annually, monthly, whatever it takes until the client is feeling better and the goal set by their professional clinical staff has been attained. And so the need for more counselors is there. I am hiring. And so anyone out there who has a counseling degree, who may be or retired even, we're willing to have a conversation with you, because we do need more counselors to provide the services that COVID is going to go away soon. We heard from the U.S. Surgeon General that by the end of the year, or definitely by January, there'll be a proven safe vaccine. So we're almost there, Guam. We just need to hold on. We need to make sure that we continue practicing our social distance, our masking, our washing the hands until January. We're almost there. We are on, and so we just need to continue that. We need to stop the spread. The numbers need to go down in the community of positives. The numbers need to go down in the beds, COVID beds in the hospital. And then, by February or March, the U.S. Surgeon General, yesterday's audience to the address of the people of Guam, stated that because we are a small contained island of 150,000 people, we can quickly be vaccinated, quickly. Mm-hmm. Guam Behavioral Health had just applied and has been approved, or I believe we applied and we're being reviewed, and I see no problems of getting approved by public health to be a vaccine hub, which means soon I can be giving flu vaccines at Guam Behavioral Health to all our consumers, instead of them going for us for certain services and then going to public health or their private clinic for vaccine. Pretty soon we're going to be able to take care of them all in one shot. Mm-hmm. They can come in, see their counselors, see their psychiatrists, see their psychologists, get their flu shot, walk out the door and be good. That because we're applied and we're being reviewed as a vaccine hub, the same process will happen when the COVID vaccine happens. We're going to be able, so with so many hubs, and hubs mean, public health and all the clinics on Guam and GMH and Guam Health being vaccine hubs, we're going to be able to vaccine our island rather quickly. 150,000 people, it's easy. So, so I'm just encouraging the people of Guam to please be diligent. We want to have a good Christmas holiday, but we want to have a safe Christmas holiday. And so what we do in the month of November is going to determine how open or closed December is going to be for all of us. Yeah. And And as the Surgeon General stated yesterday, all we need to do is concentrate on the 4 W's. Wash your hands, wear your mask, watch your distance, and most importantly, have the will to reduce the spread and become healthier. So,
all right. There's a new W, guys.
Well,
4
thank you.
W's.
Yeah.
Thank you, Therese.
Before we let you go, I wanted to just ask
Yes.
about I know that you had positives in the group home. I'm pretty sure that's resolved by now, but have you had any?
That's resolved. Thank goodness that has been resolved. Our group home was the children's group home. We had staff and clients ill, but thankfully, thank God, they were all asymptomatic, continued to be asymptomatic during their isolation, and has been cleared. And so that's a blessing. But just like every other department, just like any other household, I have staff who has COVID. We have a couple of them right now, but and we do have one that's severely ill at Naval Hospital. And so I ask the people of Guam to continue to pray for those who are ill, especially those who are critically ill. They need our prayers. We need to lift them up. And we're doing what we can to really contain the virus, because if my staff gets sick, and thank goodness for telework, because that's probably the reason why I don't have a large number of staff that's COVID positive, and the spread is practically zero at Guam Behavioral Health, because many of our work can be done telework. Unlike my friend Rory Respicio, who's at the port, and they really can't telework those containers, can they?
Yeah.
So there's departments and task and businesses out there that cannot telework. So their risk of spread and getting ill with the virus is much greater than those of us who can do most of our work telework.
So you have 2 staff that are currently COVID positive?
2 staff, and one who's severely sick. And so the key there is that I can't afford even one staff to be sick, because these are professional staff.
Right. Yeah.
I've just talked about the strain in the professional staff services, right?
Yeah.
With the number of cases. So I'm constantly enforcing in my staff the need to take extra care, because it's not just because I care for them, but because there's so many people of the caseloads they're carrying that need them readily healthy and readily available to respond.
Therese, so these 2 positives, did they come into the center? And
No, unfortunately, it wasn't a spread that was caught in the center. It was a spread outside.
Okay.
So again, one of the things that we also need to be very mindful of is our behavior after 5 and on weekends really matter. You know, I think businesses, departments, GovGuam departments do a great job. I mean, it's already ingrained. You're going to work, mask, social distance. I mean, it's everywhere. Your supervisors are reminding you, there's posters everywhere. Staff is saying, hey, back off. You know, don't get too close to me. People saying there's 3 people limit in this room. There's 4, step out. I mean, people in the workforce is doing what they can. But it's when they leave the workforce, when there's not that many reminders, if you will, and mandates, mandatory this or that becomes tricky. Right. And so we really need to emphasize that what people do outside the work area outside your work area and your work environment truly matters, because if you get sick through a gathering after 5 or on weekends, the likelihood, and you have to come into the office, or you're not working telework, you have a greater increase of spreading it to your coworkers. Majority of spreaders or carriers of the virus are asymptomatic. So it would be wonderful if everybody who had a cold, we could recognize and say, oh, you have a cold, stay back.
Right.
But that's not the case. Majority of people are asymptomatic. So I think the rule of thumb is act like everyone's positive and everybody will be careful.
Okay. Therese, thank you for that those words of wisdom there at the end, and God bless you and your staff. And we're gonna put some prayers up for your staffer at Naval Hospital. Keep us posted, okay?
And,
Take care.
Thank you so much. My regards to everyone. And Paul, nice seeing you. I'm gonna step out and go to a public hearing now.
Thank you.
very
Thank
much.
you.
Thanks, Therese.
Have a safe weekend.
You